Hello, Dr. James Bogash, expert in health longevity, and also the author of a book on migraines and epilepsy. And in the book, talking about epilepsy, it's really about healing the brain, making the brain function better, as opposed to just medicating a seizure enough so that one brain cell can't talk to the other one. And that becomes... It's definitely a pet peeve of mine, is that we're not working on fixing the problem. We are just trying to numb the brain enough. So things that fix the problem or address the underlying problem are obviously a good idea, right? So without going into too much detail, a lot of times with epilepsy, what you have is the brain, the neurons, the cell membrane of the neurons can't stop the cell from depolarizing. An important part of that is maintaining integrity of the cell membrane. The healthier the cell membrane is, the better that neuron, the brain cell, is able to not fire when it's not supposed to and fire when it is supposed to. We know that healthy fats play a big role in the health of the cell membrane, in the brain cell in particular. So it would make sense that fish oils might play a role in treatment of seizures and epilepsy. And sure enough, the first study came out over 20 years ago on the potential benefits of fish oils in epilepsy, but we're now 20 years later and it's still not common use. So what we have in this particular study, a review, was a meta-analysis looking at all of these studies, and they basically found that there was definitely an improvement in seizures with the use of fish oils. On average, it was per month, like a little bit over 4 less seizures per month. These studies are usually done on drug-resistant epilepsy or the seizures where medications are not helping and people are still having breakthrough seizures, which is about 30% of the people with seizures. It's a pretty big chunk. So we have these patients with the seizures, the medications are not helping. So we throw something natural on top of it, right? There's not a downside. The cost is insignificant compared to the medications that they use for these. And so if it helps, it's helping with some of the worst of the seizures, right? The resistant seizures, the retractive or retractable epilepsy. And so despite these being the toughest cases, we see a positive benefit with the use of fish oils. Now in the studies, it varied anywhere from 300 milligrams up to 1,700 milligrams. It's a pretty wide dosage. There's some other factors that go in, but quality of fish oil plays a big role. We know that there are contaminants that are present. Typically, for the average person, depending upon diet and what we're looking at giving the fish oils for, I typically recommend 1,000 to 2,000 per day. That's a pretty safe dose and relatively inexpensive. You just got to make sure you've got good quality. So, the important thing with this is that we're looking at different approaches that can help to fix and address the underlying issues. Despite being managed medically, which was not fixing the problem, we add the fish oils, and this helps actually work on fixing the problem, making those brain cells healthier. It would make sense to me that we should be doing that from day one, because there's not a downside to it, and not waiting until, never making the recommendation. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.